Hello, Dr. Romulo. Welcome to So Jannelle.
Dr. Romulo, we keep hearing that the worst is yet to come, or that it will get worse before it gets better. When we think about that phrase worse, how do you explain it to us from your standpoint as an infectious disease specialist?
Well, worst refers to both the number of patients that we will be seeing in the hospitals admitted, and also those who will become very sick and die. So if there's ongoing transmission now, when we think about the incubation period of the virus, which is usually a 2-week period, that's why I keep hearing 2 weeks. So when we hear that it might get worse in the coming weeks, we think about it as, say, there's ongoing transmission in the community and nothing is done, and then suddenly you impose strict social distancing measures that completely stops all the transmission, which of course is not happening now. But in case, let's just say theoretically you have that situation, so we would expect continuous numbers of cases to be admitted.
We're being advised here, especially in California, where we started I think we started this shelter-in-place around March 14, around that time. But they're saying that these next 2 weeks are going to be critical, that they're advising that you don't go out even for essentials, even to the groceries, even to the pharmacy. Why is that?
What you're describing is more strict social distancing measures to strengthen the total effect on the spread in the community, to stop this spread more effectively.
So here in our household, for instance, we have stopped going out completely. What we're doing is, if we need groceries, we need refill, we're having it delivered. Per CDC guidelines, and as a specialist, what do you recommend? Very simple terms, things that we can do. Do we go out, or do we just have it delivered? What's safer?
Well, if you can have it delivered, that will prevent, or you will avoid exposure to other people who might be inadvertent carriers of the virus. So that has that advantage. If somebody delivers goods to your house, you are able to control the infection by just simply wiping down the surfaces of whatever is delivered to you.
What about wearing facial protection, face masks? Up until recently, it was discouraged that you were only supposed to wear this if you're showing symptoms or you're not feeling well. But now they're saying everyone has to do it. And when you say everyone has to do it, of course, obviously going to the grocery, going to the pharmacy. But what if you're just taking a walk outside your house, for example, on your street, around your neighborhood?
I do like the idea of everyone wearing a face mask out in public. The main reason being not that for that person's protection, because it's really not going to protect you from the virus, but it is for continuing to stop the transmission. For example, if you wear a face mask and I see you in public, it will remind me, oh, we're supposed to stay apart from each other.
Right.
The other reason is that you won't know if you're an asymptomatic carrier, because obviously you're asymptomatic if you are, and you can potentially transmit the virus to others inadvertently. So having a mask will prevent that also. It would stop you from creating respiratory droplets that would contaminate other people or surfaces around them.
Doc, so with everything that you have discussed, this is something to be taken seriously.
Oh, this is extremely serious. You've seen the death toll. Now, what can be more serious than death? And people take it lightly. If you find out that you're an asymptomatic carrier, you're feeling fine, but you inadvertently, without knowing, transmitted the virus to your elderly neighbor and cause their death. That is a very serious business. We need to take it very seriously.
What shouldn't we do at this time? Your top 3 things that we need to remember.
Well, I will just reiterate what the authorities have been telling us. Don't leave your home if it's not absolutely necessary. Don't forget to wash your hands and keep them clean. Basically, the idea is keep all the potentially infected surfaces clean. And the most potentially infected surface is the surface of your hands. Don't be negative about this whole thing. You know, there is difficulty. You know, we're very inconvenienced by this whole business, but we just have to keep positive and watching out for our loved ones and our neighbors and not making them sick.
Right. And when we talked about the don'ts, what about your top 3 do's that we must absolutely do?
Well, I'll just flip it around. It's just do the social distancing and follow those rules. Those really are crucial for us to control this epidemic. Right now, that's really the only thing we have. We still are not complete with our diagnostic testing. We still don't have proven therapeutic interventions. We need to prevent the virus from spreading in the communities and overburdening our health system. So
everyone's asking, until when? Do we know? Can we predict based on the trends, based on a curve, based on a graph? Until when do you think? Some people are saying, you know, by April 20, by end of April, by end of May is when this is gonna hopefully be contained.
It's really hard to predict. I don't think anyone can predict, but one logical conclusion will be the sooner we enforce the social distancing very strictly, without any loopholes, without any breaches, the sooner we do that, the sooner we'll get this epidemic under control. Really strict social distancing like you're asked to do in California is going to be the key.
Well, thank you so much, Doc, and we hope to talk to you again in the next few days, maybe hopefully some better news, or just to get turn to you for information here on So Jannelle.
Sure, Jannelle. Thank you for having me.
Stay safe and stay healthy.
You too.
Thank you, Doctor. Mag-ingat din po kayo. Yes, when we return on the show, we have tips on how to manage debt during the coronavirus pandemic. Stay with us.